Congratulations, you've made a major improvement in your dental health. Now comes one of the most critical parts of the whole process. You need to go home, rest, put your feet up, and relax for the next 36 hours. This is a good day and a half to catch up on your reading, writing, watching television or movies, resting, and relaxing. This is a bad time to work in your garden, exercise vigorously, take your dog for a long walk, play actively with your children or grandchildren, or even cut the grass or work in your flower bed. The time you spend now taking care of yourself will determine how you're going to feel for the next few weeks. I hope you've taken our advice and stocked up on soft foods, liquids, things that you can enjoy and are a treat for you. Although you can enjoy your warm soup and warm coffee, I encourage you to have as many cold things in your mouth the first 36 hours as possible. Things that melt in your mouth, like ice cream, frozen yogurt, smoothies, Slurpees, Frosties are best, or just let ice chips melt in your mouth if you don't want the calories. Do not chew the ice or any frozen treat in your mouth. Again, choose whatever tastes good to you. Sips of cold water and cold milk, although good for hydrating you, do not stay cold long enough and don't achieve what something that melts in your mouth can do for you. I strongly recommend that you avoid alcohol and carbonated drinks for the first 36 hours. Alcohol and carbonated drinks can affect the clot that forms in treated areas, and you may get bleeding as a result. Make sure that you get plenty of protein and carbohydrate and a small amount of fat in your diet. Scrambled eggs, soup, supplements like Boost or Ensure, soft pasta, soft sandwiches, tuna fish, Jell-O, mashed potatoes, pudding, and so on are all good. Think Thanksgiving dinner. Focus on choosing things that you don't really have to chew to protect the area that we have treated. If you can't eat it with a spoon and just swallow, it's probably too hard to chew. Again, nothing hard, nothing chewy, and cut your food into small pieces. I like to have my patients take a multivitamin and a calcium with vitamin D supplement on a daily basis. This is very good for you in the healing phase, as well as in the long-term maintenance phase. If you have dietary restrictions or concerns, please tell us about your restrictions before you leave. If we have prescribed an antibiotic, make sure you always take it with some food. If we have prescribed metronidazole and augmentin, and we will make this very clear to you if we do, then you need to take your 2 antibiotics as directed with a few tablespoons of Pepto-Bismol, or the generic. Every time you take these 2 medications, you need the Pepto-Bismol to coat your stomach to prevent diarrhea and an upset digestive system. When you are taking metronidazole, it is very important that you do not drink any alcohol. Any beverage with alcohol will make you violently ill if you are taking metronidazole. If we prescribed ibuprofen, it is not only good for discomfort, but it is a good anti-inflammatory drug, which will speed up your healing. Please take the ibuprofen as directed during the healing phase for the first week, as long as it doesn't irritate your stomach. If I prescribed a narcotic pain medication like Vicodin or Norco or Tylenol 3, take one before the anesthetic completely wears off and see how you feel later on in the evening. Don't hesitate to take one when you go to bed this evening. It will help you sleep better, and you will start to heal better if you get a better night's rest. Prop your head up with a few pillows tonight so that your head is higher than your heart. If possible, attach an ice pack on the area that we treated throughout the first evening after your surgery. Either prop the ice pack against your face and try to hold it there, or use something like an ACE wrap or dish towel to secure it in place. Don't do anything that would restrict your breathing, but if you can keep an ice pack on your face throughout the first night, it really reduces the likelihood that you will have swelling and discomfort the next day. Do not smoke, and do not use straws. Smoking and straws produce a suction in your mouth that will cause your clot to become loose, causing bleeding, and possibly lose the benefit from the procedure that we completed today. Usually, there is minimal to no bleeding after the kind of procedure I completed for you today. If you truly take it easy and relax, keep your head elevated with ice against your face, you should have minimal to no problems. It is normal to see a small amount of blood in your saliva. The enzymes in your saliva that help you digest meat proteins will slightly break down the clot that forms in the treated area. If you develop some minor bleeding from an area, you can use a moist tea bag compressed over the area to stop the oozing. Hold the tea bag steady in one place for 30 to 45 minutes without moving it across the gum. However, if there is continuous bright red bleeding, contact me immediately. If there is a protective covering on your teeth that looks like chewing gum, do not dislodge it. Leave it in place. Small pieces of the protective covering will break off over time. If you swallow a piece of the protective covering, it will not harm you. If the entire cheek side or tongue side of the protective covering comes off, please call me. Do not play with your sutures, and leave the area that we have treated alone as much as you possibly can. 36 hours after your surgery, you may brush your teeth in the non-treated areas for the first time. Stay far away from any areas that were treated with your toothbrush and floss. After you carefully brush and floss the non-treated areas, you may carefully soak the treated area with a mild saline solution. I recommend a mild saline solution with 1 teaspoon of salt in 10 ounces of warm water, about as warm as your tea or hot chocolate. It should not taste very salty to you. Following the saline, use the special mouthwash I have prescribed for you called chlorhexidine. Use 1/2 ounce as measured in the cap on top of the bottle and gently soak the area that was treated. Do not swish, gargle, shake your head, or do any vigorous movement of the saline or chlorhexidine solution in your mouth. Active movement of any solution or food in your mouth will tend to knock your clot and sutures loose and reduce the benefit of the procedure completed for you today. If I completed a gum graft today for you, please leave the plastic surgical stent in the roof of your mouth for at least 36 hours. If you left it in place for 2 weeks and never removed it, it would not hurt anything. After 36 hours, you may remove the plastic stent while you are doing your saline and chlorhexidine soaks. Then, you must put the stent back in your mouth, wearing it constantly. You may only remove it when you used the saline or chlorhexidine soaking solutions. The protective covering, if I applied one to your teeth, looks like bubble gum or chewing gum on your teeth. It is basically a Band-Aid that actually sticks to your teeth and protects the areas we treated while you eat your liquids and soft foods. However, even when you're eating soft foods, do your best to not let the food move over to the areas that were treated. This can be a challenge, I realize, when we treat multiple areas. but it is not for such a long period of time that I'm asking you to do this. If you like to exercise, plan on very little activity the first week. You can walk, but not run, and you should avoid any activity that would make you perspire or sweat. Activities like swimming, cycling, elliptical trainer, or treadmill are too vigorous for the first week. After the first week, you should be able to gradually return to your normal exercise routine. Missing a few days at the gym will not hurt you, but moving too vigorously the first week can permanently affect the result that you get from your treatment. If we placed a protective covering, as I have mentioned previously, you will be returning to the office in 1 to 2 weeks for removal of the sutures and protective covering by us. In 2 weeks, if we do not have a post-treatment check scheduled with you, you may start to clean the treated areas with a cotton ball, not a Q-tip, lightly dampened in the chlorhexidine mouthwash. You may also floss gently, but be very careful to not brush anywhere near the treated areas. After the first 2 weeks, you no longer need to do the chlorhexidine mouthwash or saline soaks, unless you feel that it gives you added benefit or comfort. Using the chlorhexidine on a cotton ball, as I described, is more than sufficient to prevent decay and gum disease from recurring. 4 weeks after your treatment, you may brush the treated areas using only the special soft toothbrush that we give you. Use the brush in a rolling technique without any circular or scrubbing motion. Brush from the gum down onto your teeth as you rotate the brush slowly. This technique improves circulation in the area as long as you do it correctly. Imagine that you are brushing your gum onto your teeth and only brush down on the upper teeth or up on the lower teeth. You can't do both at the same time. Thank you again for working with us today. I sincerely appreciate the opportunity to share in the improvement of your dental health. As a team working together, we will produce a great result for you that can last a lifetime. Please reread the written post-op instructions we gave you and call us if you have any questions regarding how you should be taking care of yourself.